Hello and welcome to another interesting video of our YouTube channel. So today we have decided to start our X-ray chest series. So this is the first lecture of many lectures coming soon inshallah about X-ray chest. So first lecture is about the ABCs or the initial things of the evaluation of X-ray chest. So first of all we will see about what what is the anatomy of the X-ray chest. So for considering the pathologies we should know about the anatomy. Okay, so for a evaluation of the X-ray, anatomy is very important. So for anatomy we should know about how to annotate the X-ray chest and what are the important landmarks to see in the X-ray chest as a beginner or as a new person who is going to start this course of our X-ray chest. So let's see what this X-ray. So first of all, we will see the X-ray. First of all, we will see that a X-ray chest, either it's PA, AP or lateral view. So first of all, we will see that it is X-ray chest. This is left side and this is right side. Okay, and now this is, we know that this is X-ray chest, X-ray chest, PA view. How have we identified this is PA view or AP view? We will talk about this discussion in our next video. So now we will, without wasting your time, we will start with the basic anatomy of the X-ray chest. So let's see the what are the basic things everyone should know about the X-ray chest. So here I have this annotated picture for you for reviewing the basic anatomy of the X-ray chest. Okay, so first of all we will start with a, we know that the basic mechanism or algorithm for evaluation of X-ray chest is our a very famous rule A B C D E F. So like ABC, it is the most easiest way to remember the most easiest ways to remember what how to evaluate X-ray chest and how to make a scheme so that we can easily see the X-ray A B C D F. Okay, so first of all, A for airway, and if we are looking for airway, first thing we will should is trachea. So here we know that here is the trachea. Here you are seeing that this is the trachea coming here, here and here. Here is the trachea, and here with the trachea division, this point is called carina, as seen is this. Okay, so first thing to look for in X-ray chest is trachea or airway. We can see for any external foreign inhaled bodies, any tracheal mass, any external tube, or any other things that can be seen in the trachea. And along with trachea, here is a very thin line. Here I am pointing out. This is paratracheal stripe. This is paratracheal stripe. Okay, you should know about it. After the trachea, the next thing is B. So B for bones. So we will always evaluate the bones in the X-ray. Now we will look for which are the bones: clavicle, right, left, clavicohumeral joint as seen here, clavicoglenoid joint, and humeroglenoid joint. Here we can see that scapula, part of humerus, these are the bones, and then the other bones that are related to the chest are the anterior ribs and the posterior ribs. Posterior ribs are shown by this line, yellow lines. You can see that these are the posterior ribs, and the anterior ribs are shown by these orange lines as seen here. You can see that, always go around them. Okay, after bones, the next thing is C for circulation, and circulation means heart. Okay, always look for the cardiac silhouette in the chest X-ray. Okay, I will make that for you. Many pathologies can be identified by this method. Okay, now we are making the cardiac silhouette. Here, this and this. I have made this cardiac silhouette for you. Okay, we can see that if it is enlarged, then size will be increased. Cardiac shadow will come here, come here. If pericardial appear, then these will there will be haziness and free fluid along this line. And another thing that start we see is our aortic knuckle or aortic arch. Here we can see the aortic arch. I will show you here. This is the aortic arch here. This is aortic arch. It is prominent in old patients and in other patients with cerebrovascular diseases or serious diseases or heart diseases that can lead to ischemic infarcts or etc. Okay, now for D for the diaphragm. We will can look for the diaphragmatic angles, their sharpness, any mass around that, any effusion in the present there. Here you can see that I will show you that how to see the costodiaphragmatic angles. You can see that this is I am making you a notch, thin notch. Always look for it. It should be blunt. If it should be blunt, if it's not blunt, if it's not sharp, sorry, it should be sharp. If it's not sharp, then there may be a pathology. When we are looking this here, we can see the gastric bubble below the diaphragm at the left side. If there is small amount of air present in the right diaphragm underneath, then always think about acute abdomen or free air under diaphragm. So that's a pathology you need to think about. Okay, and E for esophagus. Esophagus is not easily visualized on X-ray chest until unless there is a very gross anatomy pathology in the esophagus or any inhaled or ingested foreign body metallic coin other side things. They can be visualized. That comes here is the esophagus most likely, na? On the left side. This we can say esophagus. Okay, that's the esophagus. Now what's the next thing? We E for esophagus, F for fields of the lung. After all this, we will evaluate the field of the lungs. Here you can see the right lung field, the left lung fields. So the fields of the lung can be seen for any consolidation, any nodule, any patch, or any mass. Such things can be evaluated in the lung fields. After lung fields, we can see the hilum, left and right hilum. Right hilum is a bit below than the left hilum, and left hilum is a bit higher than the right hilum. Here are the hilers. We should know about the most common pathologies that causes hilar lymphadenopathy or hilar enlargement. Most common is sarcoidosis, tuberculosis, etc. etc. Okay, so what a this is the basic thing that we need to know about the X-ray chest before going to look for any pathologies. These are the basic things. In the upcoming lectures we will talk about more advanced things about the X-ray chest. Okay, in a short review, let's review that. First of all, we will evaluate the trachea, airway, and after trachea we will look for the bones. After bones we will look for heart shadow, aortic knuckle, aortic arch, pulmonary vessels, hilar vessels. After this, we will look for costodiaphragmatic areas, costodiaphragmatic angles, eventuation of these angles, blunting of these angles, free air under them. After that, we look for esophagus. Esophagus, if contains any ingested foreign metallic body, can be visualized in the chest X-ray. After that, we will look for the fields of the lung. Bilateral fields should be unremarkable. If there is any consolidation, patch, mass, etc., that can be visualized. After that, we will look at the hilar areas and hilar enlargement and other things. So these are the things for the to look for the extra chest as a beginner or as an amateur. This was the first lecture of our XHS series. Kindly stay tuned to us for many more videos about the XHS and other X-ray series. Thank you. Kindly subscribe to our channel. Thank you.